This episode of Simulation Nation is brought to you by Avkin, your one-stop shop for everything wearable simulator and standardized patient.
Hello, everybody, and welcome to this episode of Simulation Nation, where we talk to Elizabeth Horsley a little bit more about the CHESE exam. And Amy is really the one who did the interview with Elizabeth to kind of dive deeper into some of the review courses. And again, she helped write the CHESE, so it was very involved in kind of more of the back end and preparation side of it.
It's just, again, from my perspective, I think Elizabeth, where she shines, is helping people get ready for the CHESE exam. And
she will be your biggest cheerleader all the way through.
She will.
Yeah.
But there is all kinds of things that are out there to help you prepare. And a lot of them are supplied really and available on the websites for free of charge. So Elizabeth really, again, is, I think all of us simulationists in the end are trying to rub two nickels together to get $1.
Yeah.
And she will definitely find ways to do that, to find resources and things that are accessible to you, that are low cost or no cost. And I'm looking forward to, sharing that with our listeners today.
Yeah, I think this is a really great episode to just hear everything in one spot about all of your different options. And if you're going to take your CHESE, this is a really great episode to listen to and kind of hear Elizabeth's thoughts on all of it. Because I'm not going to lie, when I think of Elizabeth, I do think of the review course, because she has run so many of the CHESE review courses, either at IMSH or virtually or wherever else, but she has been running them for years. And again, I associate her very much of a cheerleader of anyone who wants to go and to get their certification.
Yeah. And to any of our listeners who qualify for the CHESE and have not taken it yet,
take it.
What are you waiting for?
Take it.
What are you waiting for?
Do it right now. Go. Sign up.
There is going to come a day, we learned from Beth Hallmark, that a new state, I think it's Washington State.
Yeah, Washington State.
Is requiring that sim centers now have CHESE certified and are accredited or endorsed.
Yep.
So
for it to count for a replacement for clinical.
Right.
Yep.
So it may not be this year and it may not be next year that it happens, but there are going to be requirements.
Don't put it off.
It's not that scary. It feels scary. I get it. Do it.
Absolutely. All right. So as we get into this interview with Elizabeth, we want to do a little bit of an introduction. So Elizabeth Horsley, she is a veteran nursing educator turned simulation inventor. Let me try that again. So as we dive into this conversation with Elizabeth Horsley, we want to just tell you a little bit more about her background and everything that she has done. So she's a veteran nurse educator turned into a simulation innovator.
I think all simulationists are innovators at the end of the day.
Yeah, that's true. That is true. She has 30 years of nursing experience. She built her reputation leading clinical simulation programs, both academically and in the hospital setting. Mm-hmm. She is the former director of simulation at the Brooklyn Hospital Center, where she revived a neglected lab, introduced deliberate practice modules for residents and med students, and woven simulation to staff orientation. I will say hospital simulation is one of the hardest places to get buy-in, and again, Elizabeth did it flawlessly in terms of her experience. She boosted safety, confidence, and team performance, and she has been trained formally as well as certified with her CHESI and CCSNE. Deeply invested in sharing best practices. She has so much experience with doing the CHESE review and has had a lot of experience inside of Canada simulation, and again, just moving that needle forward over the years. She's back in Canada now and working alongside of them for their nursing program, and we're going to learn more about all of her experience with SSH and the certifications that go behind it.
Elizabeth, thank you so much for joining us. You are a legend in the world of healthcare simulation, and I know nobody likes to be introduced that way. We're all humble, but just know that there are so many people that you have touched with your work and your professional experiences in healthcare simulation on so many levels. And your humbleness is a true Canadian humbleness. The sweetest person in the whole world. But I thank you for joining us. Today, we're going to be talking about preparing for the CHESE exam. We had Sarah DePaul on last season, I believe, and she talked a lot about what she did and what it was like. And again, just trying to talk people into the idea of like, hey, it's not as bad as what you think it is. I know that my first take into this, I was in my NLN Sim leadership group. It was 2015. And I can remember Marianne Rizzolo telling the whole group, if you don't have your CHESE yet, You should. And if you don't, if you have your CHESI, you should be working on your CHESE-A, which is the advanced. So again, for our listeners that are fairly new to this, CHESI or CHESE, it depends on how you say it. We use the word
Yeah.
CHESI, but it stands for Certified Healthcare Simulation Educator. And the A means that there's an advanced, and it just means that you have a larger influence than just working with students within your institution. That's basically what you need to prove is going on to your advanced. But today we're going to focus on working towards that certification. So, Elizabeth, again, your fingers and tentacles and all of the things that you've been doing really have a lot of what you have done as far as your professional career that has impacted people around the globe is the work with your CHESI exam, among many other things, but this one as well. I would say that's one of the things that if somebody said, hey, who should I talk to? It should be Elizabeth, right? So could you talk a little bit about the history and the purpose of the Certified Healthcare Simulation Educator?
All right. Thanks, Amy. Well, I have to say, this question, I started off down a few rabbit holes. I started the history of SSH, and so I had to peel it back because I know we have other
Yep.
questions to answer.
Sure do.
But
Yep.
from what I get, if you look at the mission statement of SSH, and it talks about fostering education, it talks about professional development, it talks about championing and upholding standards and ethics. It talks about people encouraging people to be champions in simulation by advocating, sharing, facilitating, collaborating. And when you look at that mission, that leads you into we need to have a way to acknowledge and recognize people who are doing these things, who are experts, have competency in things. So SSH itself came into being in 2004. 2012 was the first iteration of this exam, and obviously over time it has changed. It's come in. I'm just going to make a broad statement here, but I think for a while very US centric, but now it's certainly broadened out to encompass to be a globally relevant exam. Each year looking at the practice analysis, refining questions, beta questions, so getting to where we are at now. So, and who would have known with what happened in 2020 and COVID that being certified, proving you have this special set of skills, this special body of knowledge would be so important. Here we are.
Yeah. And one of the things that really hit me, I was talking to Kathy Scott, who is on the regulatory piece for the National Council of State Boards of Nursing.
Oh.
And I remember mentioning to her that we did have a certified healthcare simulation exam, and that we also had standards of best practice that that an Axel puts out. And she was shocked. She didn't realize that was there. And I thought, oh my goodness, we need to get the word out. It's just so important that we let people that know that, they touch simulation because of their roles or their professions, but they don't love it like we do, right? And so how do we help them know that there are standards and there are certifications? So even that piece of it, of the advocacy piece of, us being able to move this forward in meaningful ways. I'm part of the Alliance for Workforce in Simulation. I'm saying it wrong, but AWISH. And this committee, it's a multi-organizational committee, and we're trying to get through the Department of Labor in the U.S., and I always say it wrong, but basically this SimTech, the SP Educator, and the SP job titles listed there, so that human resources departments they have something to reference for what is the average salary, what is their job requirements. I mean, again, from a person who's bedside nurse, ER nurse all the way for years and years, and obviously have matured and grown, I had no idea that that's what HR departments utilized as resources. But it's so important that we have the certification for the CHSOS, because that allows us to say, hey, there are standards, right? The SP Educator, ASPE has something out, and then for the SP, actually AVCAN actually has a certificate. It's not a certification, but it's a certificate. So, there's all kinds of things out there now to add validity, which will help get this recognized and through. And I think once the US does, and other countries will probably follow suit as well.
Well, Amy, when you just said you were speaking with people recently who weren't aware of certification and best practice standards, I mean, that's shocking enough. But what's even more shocking is I'm coming across in my travels up here, and I'm assuming same US, people working in simulation who don't know their certification and best practice standards. I mean, it's a whole
Yeah.
nother issue I talk about a little bit, but places have changed. Let's say up here, it's been 20 years that simulation has come into programs of nursing. People have retired and left, and either their role isn't filled or it's filled by someone who doesn't have the background knowledge. So that's
Yeah.
kind of
Well,
where
and
I'm sitting at going, there's people in this who aren't even sure that this exists. And you
right.
tell them,
But at the end of the day, it costs money to be part of an
yep,
association. So if you're not a part of the association, you're not getting the journals
yeah, no,
regularly, right? You may not be aware. And then also that the if they can't afford to go to conferences, they're not
nope,
hearing about it there either, right? And so there are some remote places. I remember when AvCan first started, we did workshops all over the US and Canada, actually, to get the word out about AvCan and about the wearable simulators and about the fact that modality does not have to be crazy expensive. Like you can do this in a way that's
yep,
affordable. I did, and it's possible. And we went to these grassroots places that they don't necessarily
no,
they can't necessarily afford to go to an international or a
no,
national conference every year to hear these things. So again, the more we can get the word out in places like this where there's a podcast and
yep,
you visiting these more remote places in Canada, I know you guys are working on something up there as
mhm,
well. It's
yeah,
amazing, but people want it. It's not that they don't want it, they just didn't know that it was
yep,
available to them. So yeah, that's
exactly.
great. So can you share a little bit about your story in preparing for the CHESI and how you're feeling? Because it's an exam, and as adults, we're going back, we're being
Mhm.
proctored in an exam, so it is a little
Oh, yeah.
anxiety producing, right? And you want to pass. My institution thankfully paid for mine, so I would have to give them the
Mhm.
the fact that I passed it so that they could reimburse me. So it does produce a little anxiety. So I just want to hear about your
All
story.
right. Well, I was introduced to the CHESI during my graduate program. I did the Masters of Healthcare Medical Masters of Science of Medical and Healthcare Simulation back at Drexel. Ran
Mm,
from 2014 to 2016. It's now morphed into a different program. And I didn't know much about it at the time. I'd kind of heard about this exam in our course and that. And I sort of asked our course director about it. And she goes, yeah, you should be fine. She handed me a file folder of articles. And she said, between this and
okay.
our coursework from this year, you should have no problem with this. So I went, okay. I honestly, Amy, I'm trying to rack my brain and think if I was even a member of SSH at the time. I might have joined SSH when our coursework started in 2014, but
Hmm.
not. So, I mean, it was all new to me up here. So looking back, I'm shocked that I voluntarily decided to sit an exam. So this is 2015. I hadn't sat an exam since 1993 when I wrote my
Hmm.
College of Nurses of Ontario licensure exams. And I'm thinking I may have had a couple multiple choice exams when I did my certificate in operating room nursing the following year. But other than that, no, I
Yeah.
was not.
Yeah.
So I remember driving to the exam for anybody listening from Southern Ontario, the QEW to the 403 to the testing center in Mississauga, just off here Ontario Street. And I remember driving and I had, the classic schematic diagram of Kolb. So it's got your 4 quadrants and it's got a simulator, converger, and all the lines. I know I had that on the seat of my vehicle as I was driving. That's what I remember,
Yep.
having that sitting and, glance, like don't text and look at Kolb, or don't drive and look at Kolb. It's dangerous. But that's what I was doing on the way to the exam. Now, I sat down to take the exam and 3 questions in, and I thought I was going to start to cry. And I'm not a crier or by nature, but I went, this is hard. But I persevered and I passed on the first try. So I had that. And one of my favorite stories, as I said, I think the exam has morphed. It's certainly come more global, more aware of all the diversity of people sitting and taking this exam. But I do remember in my exam, there was a question, and I know it had something to do with US tort law. Now, I'm Canadian. As much as I knew about US law was what I saw on Law and Order. Dadoom.
Yeah.
Every week.
Yeah.
I just guessed at that one. But in anybody listening, getting like from another country panicking, those questions have long been gone. I've not seen anything like that in the 7 years I've been involved with the CHESI program. So again,
Yeah. Yeah.
beta questions, I'm sure. And I always laugh about one question, the best modality for a lumbar puncture. So one of the choices was standardized patient. I just wanted to tick it off because it made me laugh. as opposed to a task trainer. So I
Right,
did
right.
pass that exam. And, that's in the early days, the exam finding its footing. But ever since then, I've just been so thrilled and proud. And as my career has shifted, it's become so important to me to try and promote this among other people. And I
Yeah,
do.
and I think it really when you feel that sense of pride for what you do, you want to share that with
Yeah.
others, right?
Yeah. And
Yeah.
at the time, I think it was still rare. There weren't many Canadians who had it. I know we've got a good, group of people up here, a significant number now that have it. But at the time, I don't think there were many Canadians. At least I was
Yeah.
working in a baccalaureate nursing program. So throughout that group, there weren't a lot of people who had this yet.
Yeah. Well, I remember when I got my CHESE-A certification, because I went through the CHESE exam a bit later than you did, but they said I was one of 83 in the world. And I thought, one of 83 in
Yeah.
the world? Wow. It does. I mean, it does. It makes you feel
Yep.
special, but it's also, how can I share this with others? It's not as hard or it's not as scary as what you think it is. You don't have to, lecturing from a podium every,
Yeah.
every week at a conference or something like that. Like there are people that are, just love simulation. I mean, love simulation. I love simulation so much that are CHESI-A's, and we give.
Yeah.
I personally, I would give my right arm to go back into a debriefing room today and do a simulation. I just love
Yep.
doing it. I love seeing the students learn. I love seeing the light bulbs go on, and it's something that will forever be with me because it just filled something not just for me, but that I was helping other people, right? And so it's the same thing of helping people get their CHESI, I
Well,
think.
but as you know, Amy, at that time, I was coming to the end of my time at the place I was working because we
Hmm.
had a chair of the program who just didn't buy into simulation. And I can remember absolutely, zero. Why would that merit any kind of certification exam? What could you possibly have to know?
Mm.
And, so I mean, but no, and now just trying now the same place looking for people to work in their nursing learning resource center, and they say they would like people with certifications.
Interesting.
Taking a long
How the
time to get.
world turns,
Yep.
right? Yeah. So, can you talk about any advice or any helpful tips that you would give to people that are getting ready to start preparing for the CHESI exam? Like, what things would you recommend or suggest for
Well,
people?
one thing to start with, and I like to see some people get caught with this. Go to the SSH site and go to across the drop down menus to credentialing and then to CHESI, and everything will be there. But I think you need to start with that application and sort of work backwards from that. You get your application in, you get approved, and then you have 90 days from that time to sit the exam. So sort of get in your head, okay, if you think you need 6 months to prepare, and then see, okay, when will I get this application in and done and ready to go? So you don't want to
Yeah.
think, okay, I want to do this, I'll submit the application, and then you find out you have 90 days. And especially as we're coming
Yeah.
on the time of year when say October, and you're like, oh, we got November, we've got the holidays, we've got December. So sort of plan that way. Also, another thing that a lot of people are surprised when they get into the application, you need 3 references. So
Yes. I was going to say something about
yeah,
that.
your references will be sent a link and to fill out. And basically, it's people who know your capabilities and how they feel you are in being able to work with those, being able to be an effective simulation educator. I will say, I'm sure, Amy, you've filled out a lot of those references. I went through a phase where I seemed to have like 6 of them going, people asking me. And all I can say is they're not onerous or cumbersome to do. It's a fairly user-friendly system. It takes a little
Yeah.
bit of time. I don't know even know
Yeah.
how to describe.
Just like a reference for a
Yeah,
student that you're referencing for an employee or
but
that sends you a survey. It's the same
but
thing. I mean,
you need to put
you got to think about it
a
a little
little
bit,
bit,
but it's
but it's
nothing.
not onerous. That's the only way I can
No,
describe it. If the person
not at
knows
all.
you, they know your capabilities, they've seen a sample of your work, it's fine. But just let
Yep.
them know it's coming too. So yeah, I need to.
That's what I was going to say. Make sure you let them know it's coming and make sure they're okay
Mhm.
with taking the time to fill it out because, if they're going on vacation or something, it's going to delay things. It may get lost in their email inbox, that kind of thing. So make sure
Yep.
you are approaching whoever you're going to ask and before the link gets sent. And then, you want to kind of do that within a week of getting that application going, because you want to
And
hit send and they're looking for it in their inbox.
and then really go through, like I've gone through in preparing for this, Amy, I've gone through the credentialing, the CHESI part of the SSH website. So there's, you know, a guide for people planning to sit the exam. There's some references. There is the exam blueprint. Get that, print that off,
Yes.
and look at that. Maybe we'll come back and talk a little bit more about that in a bit, Amy, or however your questions are structured. Really get that. There's really a nice little PDF on there of suggested resources or things you can do for it. Also, everyone at SSH is going to be so helpful if you have questions. And a lot of times I worked with the CHESI readiness review courses for a number of years. I always said, though, those weren't questions I could answer. I leave them to the people who work in the logistics in the offices there, but they will always be more than helpful with you to ask. So do that. So I'd start with that. Other thing too is, first, actually, we should back this right up. Make sure you've got the qualifications. So go to the qualifications. First of all, you need to have approximately 2 years into working in simulation. So don't try and do this. You've just gotten this new role. You sat down and you had a little orientation and somebody gave you a couple basic articles to read. About 2 years, give or take, depending on your experiences. So make sure you have
and
that
SSH wants you to
first,
have that,
all right?
because you're going to have a hard time even getting references if you don't have the 2 years, quite honestly. So,
Yep. I mean, there's sometimes somebody, well, I've been there 20 months, or or in a previous life, I ran simulations in the military, or, there's all kinds of but make sure you've got the qualifications. Look at the application process. Work back 90 days, and then you can set yourself up. Then you can start perhaps the fun part of reviewing the materials, getting things going, and doing that learning and
once
studying.
you pony up the money, then you're really serious in studying.
Yeah, well, there's always that, right?
And so the study materials or things along those lines, you talked about the SSH website and the blueprint, and that is probably 90% of the learning is follow that blueprint, because it really does guide you. They want you to be successful. They're not trying to trip you up in any way. So just know that blueprint is there to really guide you in what the things that you should study and what you should look for. You mentioned Kolb. I would say Knowles learning theory and Kolb are the two big things of, like, you got to know those. And it actually was something new to me when I studied for the exam, because the idea of knowing these learning theories really helped me. I mean, just understanding adult learning theory, understanding the different levels of validation. I was like, wow, this is really cool information, right?
Well, I would say Kolb, Kern's curriculum development model. I know it's used in medicine, but that's the one that's standard on this exam. You may use another model within your own profession discipline, but for here, Kern, Miller's pyramid, Kirkpatrick's evaluate. If this doesn't mean anything to you right now, you just Kirkpatrick evaluation. Go look at that.
Sounds like a lot of K's.
Adult learning theories, so look at those. Those are some basic. And one thing too, this exam, don't forget, this is application of knowledge. It's not going to be like a multiple choice, like, like that lumbar puncture question I mentioned, right? It's changed. These are applications. You're applying the knowledge.
So it's a little scenario or a little vignette, and you're saying what you would do or what you would select or what you would, where you feel this fits or whatever.
How you do this.
Okay.
Yeah. And well, if you want some other study, of course, the blueprint, SSH does offer courses. Also, SimConnects. I love SimConnects, Amy. Like the general forum. You don't even have to necessarily be a member of SSH to go to the general forum, but you'll always see people say, I want to do the exam. Is anyone else interested right now? Let's form a study group, or what have you been using, or what has helped? I love it when
I wonder if there's Facebook groups too. There might be Facebook groups. I know there is for the clinical nurse specialist exam, because I joined that, years ago. So I'm sure they have those out too.
And another thing is, I really like it. Is the Healthcare Simulation Standards of Best Practice put out by an Excel. And just if I can give this plug here right now, Amy, They are not strictly for academic nursing. I don't know how many these are across the board, but these will give you some good information on basic principles you can use. And so have a look at those. Those are freely available on the Anaxel website. Again, I think if you go over to the education in the top right-hand corner, the drop-down menu, click on health simulation standards of best practice. I think those give you a great place to start. There is a CHESI prep guide available from SSH that you can purchase. There's a practice exam you can purchase. The Defining Excellence in Healthcare textbook. It's got in 2 editions now. Amy, was there anything, I mean, when I did mine, I was just given this random file folder, which, funny story, if people have heard me or they know of me, and you've been ever on the receiving end of my emails where I send you all kinds of my resources from my collection because I'm a hoarder. Well, you know what? I'll always share everything I have. But the reason I started doing that is the file folder that I was given to prepare for my exam in 2015. Most of the articles were from before 2010. Oh. And some of them were good, but over that time, I began to, and I was doing my master's in simulation, so I was doing a lot of reading. I was in the literature, and I was finding going, oh, this is perfect to write that exam. This is great. So that's how I started those collections to update what I had used, and hopefully I'm a big pay it forward kind of girl. So I just wanted to help other people. But Amy, was there anything you used when you did your exam?
Yeah, one of the other things I did, I think I bought it off of Amazon, but it was Linda Wilson's book on CHESE review. I don't know. I think she was at Drexel for a period of time. I don't know if, I believe there's a second edition out now, but it was again, it goes over all of the things. It makes you feel like you have learned it comprehensively. It's kind of like a encyclopedia, I would say, is the best way to put it. It kind of follows the blueprint, things along those lines. And I'm not sure if she's associated with the course or not or anything like that, but it was a helpful guide for me to kind of know what kind of questions would be asked and, what kinds of things that I needed to study. It's just kind of like same for me when I went through my NCLEX exam. It was like, okay, I got med surg down. I don't know maternity and peds were not my thing. So I had to study that a little bit more, but it helps you, just like the ATI exams or the HESI exams, they tell you where you should focus your studies. It just helped me know, okay, I need to focus on chapter 7 and chapter 10 or whatever it was.
And the other thing too, right? I think right now too, and this is one thing when I used to do some of the review courses, and if I had people coming back because they weren't successful, and this is the thing that they always went, oh, you have to get out of yourself and your box that you are in, and you have to think really big and really broad. On this exam, it doesn't matter, even if there's a question about piggyback IVs, it's not about the piggyback IV, it's about the principle of teaching, maybe mastery learning of how you set up a boot camp around that. Okay. You're not a nurse in this exam. It's a general for every specialty. Actually, now how would have I heard of done it? Sports medicine, social worker, we've got all kinds of people doing this exam. And also, as I say, in this exam, in both places I worked, I was a one-person shop. Okay. And my second job, the hospital job, when I was in Brooklyn, New York, we were a very low resource setting. So I was, not, as I say, the shiny glass and chrome 30,000 square foot places. But for this exam, you have everything. If this scenario is about veterinary students learning to start IVs on puppies, you have simulated puppy paws. You have everything. And what happens is people read the question, they go, well, this is what we do in our center. This is what I do. I'll give you my last job, I said I had 400 square feet. I did not have a separate debriefing room. I was lucky if I had chairs some days. The ideal answer to a question on debriefing, though, is you have a dedicated debriefing space. It's conducive to group conversation.
Which goes back to the standards of best
practice. I didn't have that, but
Exactly.
But, you do what you have to do in certain situations.
But the way that you answered that exam is according to the standards of best practice.
According to the best practice. And I have everything. And I know that's where people would get themselves a little bit you have to just get out of it. You're not. And I had a couple of colleagues up here in Canada, and we have a different kind of a certification exam for nursing. but that exam, and I had somebody I was doing some mentoring with, and he wrote both exams, and he said the CHESI, and he said it best, far broader view. You're looking at some
Yes.
operational things. You're looking at some
Yes, you are.
management things. You're looking at different, whereas the other exam is just very focused on the
Yeah.
educational process. So, if you're thinking about, yes, get the blueprint, and the blueprint gives you the percentage breakdown. There's 4 domains, okay? The percentage breakdown: professional values and capabilities are 20%. Healthcare simulation knowledge and practice, 28%. Educational principles, 40%. And resources and environments, it's just 12%. So you might not do that. You're not involved. I mean, in my jobs, I was never really well, my first job in a university, I had nothing to do with the budgeting, the money, anything, or the resources. That was kind of all handled
Yeah.
outside of me, right? And again, you look at that practice, knowledge, principles, that's the bulk of the exam. However, I kind of feel like, so people say, well, that's where I should focus is studying. Resource and environments is just 12%, doesn't matter. But if you don't do any of that and you haven't reviewed it, 12% of questions could make or
Yeah.
break whether you
Yeah.
pass this
Agreed.
exam. So there's some really, there's the operations standard in the healthcare simulation standards of best practice. I know the defining excellence textbooks have some great chapters on, around equipment, purchasing, troubleshooting, those kind of things. So really get out and have a look. Again, the bulk of the exam, that 68% is those, those theories Amy and I just mentioned, those kind of things. But don't overlook the other ones if you're not familiar with them. Because again, if you miss 10% of the questions,
Yeah,
that can make a
especially because you might
difference.
get tripped up on something, right? So yeah, for
Yep,
sure.
yep.
And then what, as far as we've kind of talked about the theories, and that's what you and I both spent time
Yeah.
on. Is there anything else that you would
Oh,
spend
I
time
love
studying on? Just like night. Where you're not supposed to study the night before. So 2 nights before or the day before.
Yeah.
What things would you stay focused on? Would it be just the theories that you've discussed, or is there other things that you're like, hey, if I could go back and do it again, I'd study this stuff too? I know.
There's so much, I would look at those theories. Again, we
Yeah.
mentioned them, or anyone wants to message me, I'll gladly. I have all kinds of little things I've done. I love, actually, side note, I was never a theory person. All I remember from nursing school is Dorothea Orm, self-care deficit. That's all I know. But once I got into simulation and education, those educational theories just opened up a whole world for me. So really, again, a curriculum development model, adult learning principles, Miller's pyramid of competency, really know those Kirkpatrick. And I just want to say here, I know there's a new Kirkpatrick model, but I believe the exam is still that basic old 4 Kirkpatrick. Again, if somebody doesn't even know what I'm saying, I think you can provide my email address.
And
and
you
I
can
can
Google it.
send
It's
them
very,
something that will.
it's not just specific to healthcare
Yeah.
simulation. This is a broad
No, it's
reaching,
for
Kirkpatrick is broad reaching, but it is something that we need to know about in simulation, because a lot of the early research was just how the nursing students liked it, or how the medicine students liked it. But now we want to know, is it translating to patient safety, which is a level 4? So you'll get it. And when you see it, you're like, oh, I understand. But it's really about the impact of the learning.
I would really know about formative, summative, and high
Yes,
stakes
that's good.
evaluation, what each one means,
Yep.
what the differences are, really. And I know there's a little part of it like called basics of research. Don't freak out. We're not making you hand calculate an analysis of variance.
Thank God.
I know, qualitative, quantitative. And 2 things. How simulation can be used as a platform for research. My favorite I need an exemplar in my head. And then I take it and apply it. So, best study I ever saw that illuminates this. A study on chest compressions for neonates. What works better, 2 thumbs or 2 fingers? That is not a study you want to do on live subjects. Simulation. Or research about simulation as an educational strategy. So what works here, what works there, how much pre-briefing, what styles of debriefing, how does the debriefing help? Really know your principles of briefing, okay? And the exam does not subscribe to any one theory. Oh, it's going to be all about pearls. It's going to be all about debriefing for meaningful learning. No, basic principles of debriefing. So you'll really want to have a handle on that.
And that's, again, they say that 60 to 70 to 80% of the learning happens during the debriefing. So it is an emphasis. Really? They want to make sure that you are knowledgeable and comfortable with that piece of it.
and have those, have those best
Absolutely.
practice. So I would have an idea of those. Oh, big thing. Should have started, and I say this, anything I'm teaching now, I start with this. This is general across the board. General principles, whether you've got a standardized patient, whether you've got a virtual, asynchronous, whether you're, now it seems like old school to be in person. These are across the board
Yeah.
principles. So, you may get a question that says you're working with a virtual group and you're doing this. Do not let them go, oh, I don't do anything with virtual. I don't understand it. I don't like it. That's not the point. The point is the principle that's applied for debriefing a group online.
Yeah.
Same principles. Think about
Yeah.
it that way. So really keep that in mind. So it's a lot, but you kind of just have to get out of your own, whatever your profession is, wherever you work, whatever your space is, come out of it, and you're in this entirely different, as I always say, the greatest, grandest simulation center ever. You have everything. You have a cadaver lab. You have those cars that occupational therapists use to teach people how to drive. You have, and everything in between.
It's good advice. Good advice.
Okay.
So, again, I said you're not supposed to study the night before the exam, but what advice would you give someone who's getting ready to take their exam?
Oh boy, I think you know more than you think. If you've been working at this, you know more than you think. Reach out to people. You're not alone in that. Poe on Sim Connects. Is anyone else doing this right now? And you will find people, even if, you know what, you go in the Sim Connects and you go in the, what do I want to call it? Searching previous messages, search, CHESI exam, see what comes up. Look around. And again, I think I say this in absolutely everything I've ever done these past 20 years, Amy. The simulation community is the most generous, collaborative group of people you'll ever meet and work with. As I say, Sim Connects, 8:00 in the morning. I need a scenario for malignant hyperthermia for 1:00 today. And by 10:00, you have 5 people's curriculums in your box. Okay. Reach out. I'm doing this exam and I just don't know where to begin. I need a little help. And someone will help. All right there.
And I'll say, I agree with you 100%. You know more than you think. The other thing that I would say is anything where it gives you a policy, you're following that policy. So don't try to bend the rules for this one given thing or whatever it is. Like that's a big thing too. But I think that it is, the more you can just go in there confidently, again, it's still anxiety producing, back many years. But the other good news is once you get this exam and you pass, you don't have to take another exam every 2 years. There are ways to recertify without doing that. And you're just showing that you're staying in the simulation world and active, and you just recertify. So don't worry about having to do it again, as long as you keep your certification active. But it is, and that was one of the things that Marianne Rislow said to our sim lead team was, you know more than you think, and this is not as scary as you think, and you all should have these 4 letters after your name. And so it really motivated me to do it. I had anxiety about doing it before that, but if there's one thing that I think Elizabeth and I can say to you is really confidently, if you've been doing this on a regular basis and you're passionate about learning, you've got the time to study, don't sweat it.
And don't be shy to reach out to people. Don't be shy. Go on SSH and see everything there that they have available for you. Okay. And, find other people. There's all kinds. I mean, this is wonderful, Amy, that you're doing this.
It's really a mission.
I mean, this is.
I was the lead for Healthcare Simulation Week, I think 2 or 3 years ago, and my whole mission was on certifications, accreditation, endorsement, all of that stuff. Because I had talked to Kathy Scott, and I was like, oh my gosh, I gotta help other people know about it. But it is a mission of being able to help people, because I think at the end of the day, when you get those certifications and you get those types of things, it gives you the confidence to even go to your leadership and say, we're not following standards of best practice here. And it just a lot of time. You said you were, you flew solo in your professions as a simulationist. I did too. And so when you feel like you're alone, you also are an expert. If you can go through the certification process, you're
Yep.
following standards of best practice, you are the resource within your institution to point to what good simulation is. So, it gives you, to
Well,
me, it gave me more confidence to speak up, because I felt as though,
oh,
I now I wasn't being judged by my peers as far as educators at the university, but I was being judged by my peers as far as educators within the simulation world. It's a
right.
very different thing. And so it just added that level for me. And I want to encourage other people to do it as well, for sure.
Well, piggybacking on what Marianne Rizzolo said to you too, is in the last few years, we've seen places, various states, you can go onto the Anaxel website and see which states require evidence of simulation preparation, i.e. certification, to be teaching with
Interesting.
simulation. We have a couple Canadian provinces. It's not across the board, but you're seeing more and more job postings looking for people who have
Yeah.
certification. So, and I've had actually a couple people when I've done courses in the past, this was, you have to get this certification to keep your job. Now, I don't mean to frighten anyone, but you don't know. But I think it's a great thing though, Amy, because we've come so far. Like my early days, oh, there's Elizabeth playing with her toys in the lab again. It was
Yeah,
so
there wasn't a lot of buy-in. No.
demeaning.
Yeah.
No, or just random bring school lab. And I've been on a couple meetings up here, and I've been shocked where places are still having nursing faculty just kill the patient. But it
Yeah.
makes no sense. There's no, anybody's ever heard me talk, the two things I talk the most about are needs assessment and conceptual fidelity. Oh, by the way, know the types
Oh,
of
yeah.
fidelity. Psychological, environmental, conceptual. Really, really know that. Sorry, I get on my little tangents, and of course I get excited
Well,
about
then they
this
should be
subject.
asking about Avkin
So
wearables and that, as far as I'm concerned, because when you think about that, all of those
Yeah.
that fidelity, when it's a real person in the bed that can respond the way they're supposed to.
Yeah.
Anyway, sorry for my plug, but it's my passion as well.
That's okay. That's okay. So, I really think, and I just feel the importance of this. I'm just, I said it started up here 2004, 2005, province of Ontario funded every program of nursing to implement some form of simulation program. You can tell I've said that line a lot. And, when I think about where we started, and I always quote my late mother too, she had an expression about flying by the seat of your pants, guessing by golly. And we did a lot of guessing and by gollying
Yeah.
in those
There were
days.
no standards.
And I don't know
there were
about
no standards
you.
at the time.
Anything I did before 2013, I'm just like, oh, that was so wrong now. That was awful.
But we didn't know.
But
I mean, I didn't know I wasn't
no
supposed to
one would
stand in the
know.
room with the students doing the simulation. When they came out with the standards, I'm like, oh, control room. That's because they'd always do something and then they'd look at me, and I'm like, trying to not have any nonverbal expressions.
Yep.
So yeah, agree.
Yeah, it's just how
Yeah.
far we've come as a profession, as a specialty, and the knowledge, and to do, and it's still people, it's not just a matter of marching students in the room, making the mannequin desaturate and go into VTAC, even though they just came in to have a carpal tunnel release.
Yeah.
And then say, what are you going to do? It's not just first week of any health professions program and throwing all your brand new learners into a mega code just to see what will happen. Simulation now, it's costly. You've got a lot more students to get through. So you need to be very effective and efficient in what you're doing. Having this kind of knowledge, this kind of preparation will allow you to just reach newer heights of what you're able to do with your learners. I shouldn't keep saying students too, Amy.
Yeah.
Hospitals.
Absolutely.
In hospitals for orientation. I worked in a hospital. Sorry, I shouldn't keep, you've got your interns coming in. Everybody can go through and, do the skills, do what they need to do, set up on different units, in situ when you can go and see how things are working, quality, safety. I mean, this is just not, I need to go back. This is not just for academic educators, hospital people, and even more important. So how do you apply some of these things? And sometimes you may even more of trying to get everyone on board. You go to a unit and you want to do, we know how to do that, or what are we doing here? Letting people know. And there's some fantastic work that's been done in hospitals across around globally, Canada, the US, getting staff involved and really using simulation to have
Yeah.
people prepared and practice. What do they call it? Low frequency,
Yeah.
high
Yeah.
acuity
Yeah.
events.
Absolutely.
Right? Or, for me, hospital, a lot of the quality, just one, a pediatric code in my old job in our outpatient clinic, and you realize right off the top, nobody knew how to open
Yeah.
the drug cart. It's those things you find that make the difference for patient safety. Oh, we can't fit stretchers in that elevator that goes to that weird little space on our 5th
Yep.
floor where we keep patients, things like that.
Yeah.
So,
Yeah.
yeah,
Well, that's
definitely.
great. So I just want to wrap up our time here together and just ask kind of,
Mhm.
a reflective question. But, you've made it your mission to really help people prepare for this, amongst other things. I know you do a million things, but this
Yeah.
is, again, if I had to say who to go to, it would be you for anything in preparing for CHESE. But can you provide some personal perspective on why you have dedicated so much of your time towards helping others towards success?
Oh, I think just because when I started out and I wasn't sure what I was doing, and then as I went along, especially the Drexel program I did from 2014 to 2016, and then I think, working in a space where they just didn't value
Yeah.
simulation. They just didn't value the knowledge, the skills. They did not value it. It was and I wasn't alone. I don't want to pinpoint that was the only
No,
place where
I can
simulation
promise
was
you it
something that
wasn't.
happened at the end of the semester. If we had time, and up here, they had those snow days blocked off. So if you had to miss a few days in the semester, so if the snow days didn't get used up, oh, we can do simulation. Or we're just bringing a group to the
Yeah.
lab to do something. But no
Right.
concept of objectives. Or speaking of which, objectives. Know the SMART acronym for writing learning objectives. Big
Yeah.
one to know for
Yeah.
this. Anyways, so I realized, and then as I got into it and the knowledge and the more people I met, and when I saw people who were doing this, using these best practices and getting more and more people on board and realizing what we're doing is a specialized body of knowledge. It is not just walking into a room and pushing
Yeah.
the buttons, So I think I got into doing this. Part of me as I had this and I thought, okay, how can I now? So how about I try to facilitate and teach this to other people, because that really
Yeah.
elevates your game when you're trying to stay ahead and find new things. And I just love doing it. I love seeing people do that to make these programs again simulate. I think back to my own career. It's been over 30 years now, closing in on 35. And I think of the things in my first time out that I was just
Yeah.
thrown in to do. And I think of a smallest of simulations would have
Yeah.
helped me
Well, that's
so
why
much.
I got into simulation, because my
And
transition to
yep,
practice was so
yep.
rough. I mean, I can remember crying. I worked the
Oh,
midnight
yeah.
shift and I had 12 patients on a med surge floor. And I just remember saying, just give me a care plan. I can write a care plan. I'm really good at it, So I agree. Yeah,
Dorothea
that's
Orem.
why I
Yeah.
took the job in the simulation center and the skill center, because I felt like
Yep.
if we can prepare them before they get there, it's such a safe place to do this. This was before, again, any standards were up, but it's like, let's let them have this
Yes.
opportunity to make mistakes in a safe place,
Well, and then when I started my final placement in school, and I was in the OR, and I had this fantastic preceptor. And this is like 1992. So this is before and she instinctively, so she would set up simulation type things for me to learn. And so I'd always remembered
that's
that,
cool.
like, because that was kind of
Yeah,
novel
yeah.
at that time, where it was just, we still were really mired in that, see one,
Yeah.
do one, teach one. Only works if the person you're watching knows what they're
Yes.
doing. And
Yeah.
well, often they don't. But so yeah, I just want people to be able to do this. You're putting a huge investment into simulation. And then what happens, what I've seen, they make this huge investment. People buy this equipment, but they don't have people who can use it properly, and it just
Yeah.
goes to waste. And nobody ever does it and thinks it's a
Yeah.
waste of time.
You really need a champion.
And then
Yeah.
start all over. Yeah, you need somebody. And I just think what we're doing, there is so much you need to know to do
Right.
this properly. There is just so much you need to know. It's not just an easy, again, people think just an easy fix, make it
Right.
DSAT, throw a rhythmia
But
up, and
I will
off you
say
go.
this.
you know.
It is one of the most research aspects of healthcare education. There's, I know Kim Leeton and Susie put out, along with many others, but put out an article that there is very little research out, or zero research out, on how to be a good clinical educator, in a clinical setting, and I remember taking students into clinical and feeling like a fish out of water, because there really weren't standards of best practice, right? It was kind of that folklore, or what got passed down from one clinical educator to another, or whatever the case may be. So there is a lot of information, but the good news is it's backed by research, and it's solid. It's going to be a living document no matter what. We're always going to be learning more. But the cool news is that we have a lot of research about how to do this well. So that certification really holds its weight, because we do have so much research behind it.
And we're a specialty group.
For sure.
Very, and you need to acknowledge that, and I think it's great.
Well, thank you so much. I really appreciate all of your time and your wisdom and sharing.
Oh my gosh.
If you have questions for myself or for Elizabeth, put it in the chat. We'll get back to you with contact information, but we thank everybody for joining so much.
Honestly, and Amy, I do not mind if people reach out to me at all. Not at all. Like, I love to help people like this. I think knowing you're not alone doing this. And especially, I know when people are coming back to this, they've had a long career and then they went into education, and it can be, I'm not sure I could sit an exam at this point in my life.
I know you could. We could do it.
I could.
We'd go in together holding hands, Elizabeth.
Yeah, but boy, oh boy, you're not alone, and you'll just feel so good. And I think once you do this, then you want to get in more. I want to read more. Like, I started wanting to, I guess that was it too. I wanted to start collecting resources that would help other people pass this exam.
Well, thank you again. Appreciate it. So have a great day, everybody. Welcome. And we will get this posted up quickly. Thank you so much. All right. Bye-bye.
I guess from the perspective of listening to, Elizabeth talk and share, I think she shared exactly what we said in the intro, which is go ahead and get that CHESE exam. Yeah. Go ahead and take it. Sign up. It's really not that bad. She really kind of gave that step-by-step introduction piece of it. I think the big takeaway with this, as far as what needs to happen in simulation and where we're going, is that the CHESE exam is a kind of living document. Like, it's going to be changed over time. They're going to have some test questions and things like that. And that's the beauty in it, as more research comes out and as more things evolve, then those are going to be wrapped into the exam, and they're going to be helpful for people. Preparing for the CHESE is not as expensive or as laborious as what you can imagine it to be. And I think that should give everybody a sigh of relief, right? You can take a review course if you'd like to, but you also can use a book, or you can use the website, the SSH website. There's just lots of opportunities that are available. Yeah, and as someone who took the CHESE exam where I did not feel confident going into the, I was so nervous. I did do a review course. I found that super beneficial for the community that was behind it. But then I feel like the majority of where I got the information was from the SSH website, taking all of the different pieces of it, printing it out, and then working kind of through that. And then just sitting down and doing it. Like, honestly, I just think that sometimes we get so intimidated by it that we feel like we need to keep over preparing. Sit down, take it. If you have the years of experience, really, it's not as scary as I think you think it is. So if you have not taken it and you are qualified to, right now, get on SSH website, sign up for it, sign up for a review course, download everything you need to download and get started. And again, just know that everyone is going to be rooting for you. No one is waiting for you to come back and not be successful. Everybody wants you to be successful. So sign up, do it, take it, and figure out where you're at. All right. Until next time, we'll see you guys on the next episode of Simulation Nation.
Thank you.